mayor is not. He asked me to introduce all the commissioners to the ethnic and community media, and this is our first event here, so it's an honor to have this event with the DOH commissioner, a very important agency that in our communities during this pandemic. So with that, I'm gonna give the intro to Dr. Vasan.
Thank you, Jose, and good day to everyone. It's a real honor to be here. It's such a pleasure to be with you at this first Ethnic and Community Media Roundtable, and my first engagement with you as New York City's new Health Commissioner. So thank you for being here today. It's an honor to be with you. Thank you to Jose and to everyone who has arranged for this event today. I'll keep my remarks very brief, but I want to start by thanking you so much for the critical role you've played in keeping New York City's immigrant and non-English speaking communities informed, healthy, and safe, in particular over the last 2 years as we've all tried to battle the COVID-19 pandemic. We at the Health Department do everything we can to make our messaging as inclusive and adaptable as possible so that none of our city's diverse populations and communities are left behind, especially on life-critical matters of health and well-being. During our COVID-19 response, we've translated our messages into, at the very least, the 13 top languages spoken in New York City. We've done more depending on the particular product and campaign. We reach non-English speakers through television, through radio, through newspapers, through YouTube channels, and through digital media in languages including Spanish, Cantonese, Mandarin, Korean, Russian, Bengali, Arabic, Haitian Creole, Urdu, Yiddish, Polish, and amongst other languages. So during the COVID-19 pandemic, we've had to reach all New Yorkers, since this was an entirely new and emerging public health threat, first of its kind in our lifetimes and really in more than a century. And the public health guidance applied to all of us. It's an airborne illness transmitted through close contact, but highly transmissible. And that made sure that despite our differences in language, that we were all connected. If the virus has taught us nothing, it's that we're all connected. And in our response, we had to make sure as much as possible that everyone felt connected to the response. Of course, that guidance applied to raise awareness about vaccination, about testing, now about treatments, and all of the shifting recommendations in a very challenging environment where the science was evolving, information evolving, and the challenge for us in public health, and the ongoing challenge, is to communicate decision making and to communicate some kind of certainty in a time of great uncertainty. And your role in this has been critical as we've developed citywide, multimedia, multilingual campaigns, as I've previously described. Many of the inequities we face in this city are deep and long-standing, and given how the communities you cover and serve have been, in many ways, disproportionately impacted by the COVID-19 pandemic, your responsibility and your role is more important than ever. COVID is still with us. Cases are ticking up, and we expect that to continue in the coming weeks. So many of the precautions we have come to know are still very relevant to us as we try to move on and incorporate them into our daily lives and our daily choices. But we also have more tools than ever to fight this pandemic, testing and vaccination, but now especially treatment, which we haven't had at this scale in any other prior wave of the pandemic. Just to be specific for a minute on treatments, for all of your readers and viewers, we want everyone to know that if you test positive, whether you test positive at home or whether you test positive at a testing site, you can find out about your treatment options by calling your healthcare provider or calling 212-COVID-19, which is 212-268-4319, and get connected with a provider to do an online or a phone evaluation to evaluate your treatment options. If someone doesn't have a healthcare provider or is uninsured We will still connect them to free help through this line, through our colleagues at New York City Health and Hospitals, our public healthcare system. The COVID virus has caused also so much pain in New York City. It's cast a shadow pandemic, a second pandemic over our city, and really the toll taken on our mental health is in many ways going to be dealt with for years to come. It will have a very long tail. It will be felt by the communities you serve, our children, and people with serious mental health problems. They came into the pandemic with serious mental health problems. Nearly every family has been touched in some way by mental health during this pandemic, including my own. And it's never been more urgent that we speak openly about mental health, to foster connection, to promote healing, and to make mental health a centerpiece of public health and of our citywide recovery. And I know specifically, coming from an immigrant background myself, how difficult it is in some cultures to talk about mental health. How much stigma and discrimination and cultural difference we have. But we as New Yorkers need to center a conversation about mental health not as weakness but as strength, as a form of strength, a form of healing, and a form of recovery. Mayor Adams and I and this entire administration are determined to make mental health the centerpiece of our work. Given how our recovery is made possible also with our vaccines, I ask you to keep urging your readers, viewers, neighbors, and constituents to get vaccinated if they haven't, and to get boosted if they are eligible. Again, we are in a much better place to respond to COVID now than we were 2 years ago. Even with the cases rising, the advancements we've made, and the lessons we've learned from powerful treatment options to widespread testing and masking and vaccines leave us very prepared to meet whatever comes. So I hope that your audiences will feel that we are prepared and they are prepared. By far and away, again, the most powerful tool at our disposal remains our vaccinations. Overall, New York City is doing great. More than 77% of New Yorkers are fully vaccinated, but that's still not enough. And given that COVID is not over, we need to ensure also that people are getting their boosters when eligible. We've been talking about this for more than a year and a half, and I'm going to keep talking about it because it really is our best way to take back our lives, to recover as a city. So get vaccinated and get boosted. So I'll stop there with that. I'll take any questions you might have. I appreciate you again for being here and look forward to the discussion.
Thank you, Commissioner. So this is the rules. We are going to have one question per reporter since we have a high audience today. Please identify yourself and the outlet. So let's start with Isa.
Yes. Good morning, everyone. My name is Issa Juf Campbell from Africa in Harlem, covering the African immigrant community and the large African diaspora. We're seeing now an uptick in cases. Is it another wave coming?
It is certainly an increase in cases that we're watching, and we expect, as I said on Friday at the wider press conference, we expect over the next couple of weeks that we will see a level of transmission in New York City that will move us into a slightly higher level of risk, from low risk into medium risk. But there are tools we can take right now as individuals and as well as the city to help us flatten that curve as much as possible and to bend it down as much as possible. That includes wearing our masks in indoor settings. I'm pleased to see many of you making that choice today. Again, it's about choices. It's not about mandates, it's about choices. It's why we preserved some selective mandates in some places, and it's why we're educating New Yorkers about getting vaccinated, getting boosted, and getting treated, because at the end of the day, cases are very important, as well are hospitalizations and severe outcomes. We are trying to prevent the most severe outcomes, and I think we're better prepared to do that.
Weekly Bengali.
Hi, Commissioner.
Hello.
Congratulations.
Thank
Because
you.
the first time we are meeting with you. My name is Kaushik Ahmed. I publish weekly Bengali newspaper for 21 years for Bangladesh people.
Thank you.
So I have a question. This question is that, as you know, there's about 40,000 people died of COVID in New York City. So do you have any list, any data, continuous, like if I want to know that how many Bangladeshi people died in COVID, is there a possibility that I can get it?
I'm happy to talk to my team about whether we've collected demographic data about the deaths and how they've been spread out across communities. I'm happy to come back to you.
Yeah, we're gonna get back to you. Monica Radio.
Monica Adamski, Radio Rampa. I'm representing Polish American community in
Hello.
New York City. I have a question with regards to the masking for kids under 5 years old. This is a mandate that state about the challenges. You just said you support choice. With that, could you refer to that? Many parents are asking us, why do they have to mask their children, whether all of them are vaccinated, adults are vaccinated? Could you please address those things that we're hearing also from our community? And I just want to mention, since this is a conversation, that Polish community heard about vaccine testing and everything thanks to your campaigns, which is very good for our community, because at the beginning of COVID, I have to tell you, the person I was translating every single press conference for the mayor, for the governor, because our listeners had no idea what's going on in the city, what are new restrictions, everything. You were not here, I know, in this capacity then, but I just want to let you know. And also, I see many campaigns in American radio done in English, which we don't have in Polish. And I see some campaigns being done on Facebook in Polish. And I'm wondering and asking if these campaigns are paid to Facebook instead of Polish-speaking media in New York City. Is that something you can address? Because I see those ads, let's say, for affordable healthcare in hospitals right now. There's a campaign on Facebook, and we don't have that campaign on the radio station, which I feel is important to what you just said. As treatment is available, people also should know about it. So I know many issues I wanted to.
Yeah, that was a lot of questions.
Masking for
Just
kids, that's
wait.
something that I'm getting the most
We
often.
we can discuss about the advertising area
Okay.
after.
Yeah,
after
but
this.
I'll let Jose
Yes,
and
I'll-
my
I'll
team
can
talk
handle
about
that
Could
one.
you address the masking
Look,
kids
I-
under 5? That's something that we're getting a lot.
Sure. I would start by saying these are not easy choices. We're doing the hard thing. It would have been easy for us to say, lift everything at once and, let things happen as they happen. That's not, we didn't feel like that was a responsible or a safe choice, especially when we can see that there is going to be an increased level of risk, but it is going to be temporary. It is an increase, a wave, a surge that will eventually pass. So we're not talking about a permanent mandate. We're not talking about anything indefinite. We are talking about an extension of the mandate for a short amount of time. When we make these decisions, we take into account data. We also take into account an overall assessment of risk. And for this population, under 5s, there is no vaccination available to them. And I think as a city, and certainly the mayor feels this way, we have an extremely low tolerance for bad outcomes in our babies. I say that as a father, I say that as a public health official, I say that as a member of this administration. We have an extremely low tolerance for bad outcomes, complications in children, as rare as they might be relative to other populations. So that explains the decision.
Thank you.
Thank you.
Univision.
Yes. Nice to meet you,
Nice to
Commissioner.
meet you.
My name is Berenice Gandhi from Univision. Gusto en conocerlo, entiendo que habla un poco español.
Un poco, discúlpame, mi español no es perfecto, pero entiendo todo.
One of the things that everybody is suffering in your city now is the mental health issue, and for the Spanish it's a big thing too, especially for our kids, our teenagers. How we can help our kids to survive this pandemic that left them behind in a mental hole. ¿Cómo podemos ayudar a nuestros niños y adolescentes a sobresalir de esta pandemia con todos sus problemas mentales que nos dejó?
Yeah. Y puedo responder en español un poquito, pero mi español no es perfecto, pero voy a cambiarlo. Para los niños, soy un padre, tengo 3 niños, tres hijos, y mi familia experiencia las consecuencias de la pandemia, del efecto secundario de la salud mental en mi casa cada día. So, es un problema muy pragmático, real en mi vida. El sistema de salud mental en este país es rompido. No había suficientes recursos y policías y apoyo para este sistema, y la oportunidad de la de esta pandemia y los efectos secundarios es que finalmente necesitamos come together para apoyar este sistema para los niños, para las personas que tienen muy grave síntomas de salud mental y es una oportunidad también de trabajar con nuestros compañeros en el Estado y en el gobierno federal. El presidente dijo en el State of the Union 2 semanas pasadas sobre los recursos, nuevos recursos para la salud mental, para los niños especialmente. Es una prioridad de esta administración, es una prioridad personal, es una prioridad de mi departamento también.
La salud mental está cubierta por los seguros. Insurance covers mental health
Entiendo.
issues. But what about the community that is immigrant that doesn't have the insurance? Is that the city covering this part? It doesn't matter. They can apply to the free medical care.
El sistema público de nuestros compañeros, nuestros partners en Health and Hospitals, el sistema público de salud, es una opción. La otra opción es el network de organización comunidades hispanohablantes también, que tiene programas y apoyo de salud mental. The way in which we deliver mental health care in our communities is not just through our health systems. It is through our community organizations. It is through each other and peer-to-peer conversations. Mental health care is not like you need to see someone in a white coat with a stethoscope to check your heart or to take blood. It is about creating space to heal. And especially in immigrant communities, we need to create that space within our communities, within our community organizations, and the city is here to support you in doing it.
Okay.
Yes, I don't, Commissioner. Thank you for giving
Hello.
us the time to be here. And I ask question. My name is Al Hajindo from the African community, mostly the West African community. We've been serving our community for the last 20 years in the media, WPAT. The question is, in our community, as you know, most of them didn't believe in the beginning. They didn't believe in getting the shots. Now, most of them did get the vaccine. Now we come back to a point where now they're telling them that you must have the booster. Some of them did get the booster. Now we just come back and saying, if you're 50 years old and over, you should get the second booster. So people are starting now to ask questions. So I wanted to know if you can give us more details so we can go back to them and let them know.
Yeah.
Why should they, is it really necessary for them to get the booster? If yes, why not?
Yeah.
Thank you.
And look, I understand people are tired. I'm tired. We are all tired. We're fatigued with all of the recommendations, and the science is changing. And what we learn, remember, 2 years ago, there was no COVID-19. There was no SARS-CoV-2. So what we're learning every day is the recommendations we're making every day are in response to changing science, changing information. We know clearly that boosters give us greater and longer protection against infection, and especially against severe disease outcomes like hospitalization and severe illness and death. That's the most important thing. Boosters help with this. Whether it's your first booster, and we're encouraging everyone who's eligible for their first booster to go get boosted. If you're 50 and up, we recommend you go get the second booster, because we know over time immunity falls, immunity wanes, as also the virus changes. So we recommend everyone who's eligible for a booster, first, second, go get it now, especially as cases are rising.
And it's safe.
And it's safe. The side effects of these vaccines, it's truly remarkable that we've developed vaccines this quickly that are so safe. And we should all, it's really a testament to the human condition and the human endeavor that we were able to do this so quickly. So it's incredible that how safe these vaccines are, and it's definitely safe to get boosted.
Thank you, Commissioner.
Asian media.
I'm Alex from Northern, one of the biggest the Chinese active media. Yeah. And my question is, if the cases continue to rise, is it possible for the city to reinstate the mask mandate for public school and the vaccine mandate for public for private sector?
We are looking at the data every day, and we're not going to tell what we're going to put in. We're looking at the data every single day. I start my day every single day with my team and the mayor reviewing, and all of our policies are up for discussion depending on the state of the pandemic.
Yeah. Queens.
Michael Nussbaum from the Brooklyn Queens Daily Eagle. I thank you, Commissioner and Director Bayona, for convening this meeting with the ethnic media. This is around this table and room are the people that you're trying to reach. It's also the people, majority of the people in New York that are most affected by COVID and health issues. Beyond the other newspapers, very few of them that cover the city but don't cover these communities. I'm concerned that in order for the city to reach the right population that is most affected by COVID, the lack of health care, needs of mental care, that the city, if we can provide those communities with enough data. These reporters and people around this table, they get the data that are the most affected communities. They can then communicate the urgency that the city wants to do in terms of bringing up the levels of vaccinations and other needs. But without that data, by the city keeping that data within itself, it may be negative at times by showing one community a little higher rates of COVID than another, but that data can be explained by the next level by saying, let's correct it. So there's a need of a partnership with the media, particularly in the communities that are affected, that you can provide that to guide us in covering the news and provide you with local information, because those kind of people in the community, as you said, you know, not government entities, but the community entities, the structures that are there in the neighborhoods, if they have the data and they know that one particular block is more affected than another block, or one community, or one ethnic group has a greater, like the Bangladesh community, people need to know the numbers. So if you can provide that, the storyline is much more beneficial to the community and to the city.
Thank you.
Thank you.
Yeah,
Yeah,
is it a
go
question?
ahead.
All right.
No, no.
Is it- Yeah, I think, number one, I think I'm very proud of the city in the level of amount of data that's open source. We have the most open source COVID data of any jurisdiction in the world. I don't know of another COVID website where you can look at that vast amount of data and download it for yourself as well through open data. We do disaggregate data by ethnicity and race, but we haven't gotten, you know, I think we are always open to new ideas about disaggregating further, targeting specific communities, and tailoring messaging to those communities. That's been a commitment of our COVID response, and we're always looking for ways to get better.
But you, in the press release, you talked about 30 communities that are most affected. If the data from those communities can be given, that would be helpful.
Let's
Yep.
connect with
We'll offline
Pedro
about that,
is
for sure.
here, so we can follow up on that one.
Sure.
So, hold on, NTN 24.
Thank you. Hi, Commissioner. My name
Hello.
is Alejandro, and I'm with NTN 24, TV News in Spanish.
Hi.
My question is on vaccinations. So, making the headlines today, we have new word from the FDA saying that the vaccines that we have right now might not be as effective to combat the BA.2 subvariant. So, what do you make of this announcement? Should we be concerned or not? And after all, should this be or could this be a problem since we are expecting a new wave? And how bad can it really get? What are you expecting?
Yeah, I'll start with the recent FDA suggestion or the press reports. We definitely saw in the Omicron wave that this virus had mutated to transmit much faster than we even predicted. Nobody predicted in November that we would see 60,000 cases a day. We were averaging about 60,000 cases in New York City a day. Previous waves, we never really got above, except for the very first wave, we never really got above 3,000-4,000. And so that's something to keep in mind. It moved fast, but what we showed very clearly is the vaccines remain strongly protective against severe illness, against hospitalization, and of course against death, which at the end of the day is the most important outcomes we're trying to prevent. We also have treatments to reduce the burden of symptoms. So for anyone symptomatic, they need to call our numbers or go see their healthcare provider to go get treated. I think the question about whether our vaccines are more or less effective, right now there's no evidence that they are less effective for BA.2 against severe illness and hospitalization and death. And we're still learning about transmission.
Yeah. New York One Noticias.
Hi, I'm Angie Hernandez from New York One Noticias. I'm gonna ask you a question in English and in Spanish.
Okay, I'll try.
With the wave expected and the COVID-19 cases rising, and knowing that the minorities were the communities that were most affected, how do you see this community, specifically in Queens, which was the epicenter of the epicenter? How are these communities standing right now, as we speak, in terms of the cases and in terms of the vaccination resources that are available?
Yeah, we've done a lot of work through our public health core program to partner with community-based organizations, over 80 community-based organizations in the most impacted parts of the city, including neighborhoods in Queens, to ensure that vaccine messaging, to ensure that COVID messaging, resources, as well as access to care is brought to those places, whether it's mobile, whether it's our stand-up infrastructure, the mass vaccination sites, or whether it's through the healthcare system. We're making sure that whenever we go into communities that are hardest hit, that we're also pairing it with access to care. So right now it's still quite early, but the patterns have been consistent in that certain communities have been disproportionately impacted by COVID. We are doing our best to ensure that those gaps close, especially in vaccination and protection and access to treatment for this coming year.
¿Puedo decir esa pregunta en español ahora? Por favor, ¿lo puede responder en español?
Trato.
¿Cuáles son los recursos disponibles ahora, esperando una nueva ola de casos en comunidades minoristas como Queens, por ejemplo? ¿Qué hay ahora mismo? ¿Cómo estamos viendo los casos y la vacunación? ¿Hay recursos para estas personas?
Tenemos recursos en estas comunidades vía los compañeros en el New York City Health and Hospitals, el sistema de salud y programas del Departamento de Salud. Hay locaciones para vacunas, para pruebas y para tratamiento que son nuevos y muy importante por esta ola, por esta posibilidad de un ola. No hay ¿cómo se dice? Deficiency or gap?
Deficiencia.
No es una deficiencia, pero la nueva cosa es que los partnerships con las organizaciones, comunidades que tenemos entre su programa de Public Health Core es nuevo y es una infraestructura para acceso de estos recursos para las comunidades que son muy efectivas.
Qué bueno. Aquí.
Lo siento para mi español.
Okay.
Señor, sí. Yeah.
Dr. Vasan,
Hi.
I'm Clive Williams from Where It's At.
Hi, Clive.
We're based in Queens.
Okay.
We've been newspaper now for almost 20 years in Queens. And, we want to thank you for holding this forum. You've interwoven mental health with vaccination. Now, to those of us who know, it might be obvious the fact that you've interwoven them. But what do you expect to get from weaving them together? Because most of the questions here this morning have been on vaccines. And we really haven't focused on the impact it does have on mental health. How do you plan to build that out? Because the interest is always going to be on vaccines, the impact it's having, and the results we're getting. But we're not emphasizing the mental health part.
It's a good question, and that's part of why I will continue to raise it at every opportunity, because that's what's causing us so much pain. We have felt trauma, we have felt isolation, many of us have lost loved ones, we have witnessed trauma and loss over the past 2 years that many of us are not dealing with, can't deal with, need to find resources to deal with. And so part of my job in this role is to continually lift that message up, that now is the time to do things like call NYC Well our hotline to connect you into mental health resources, even just to talk to somebody. Even just to talk to somebody. Because, again, as I said, it doesn't have to be through a hospital or with a doctor in a white coat. It can be with a counselor, a social worker, a mental health provider. Now is the time. If you've ever contemplated going to talk to someone about the way you're feeling, it's not a weakness, it's a strength. And now is the time to exhibit that strength, and I'll be lifting that up at every opportunity, even if we're talking about COVID.
Can I prompt you also, I know this might not be your bailiwick, but many of these local papers are owned by small, very small businesses, micro businesses, and they are not getting the help in terms of the advertising to promote this in the community. So we need
I'm gonna follow up on
advertising
that.
dollars.
You can talk to me after the roundtable.
Okay.
I'm gonna follow up on that. I promise. That's a good question. Thank you. And Asian media here.
Commissioner, this thinking with NTD, we're the largest Chinese American television network in the U.S. So I would like to know, as the Chinese immigrant become the second largest immigrant in the New York, and especially during the pandemic, they are not only suffer the pandemic and also the crime, and they worry about also the mental illness issue. So I would like to know that DOH can offer what service or the help to especially the Asian or Chinese community.
I want to start by saying this is a big priority for me. I am a proud member of the API community, and though we are different, we may not have the same language or we have cultural differences, we are all one community, and we have to come together as one community, the API community. I'm also aware that Chinese Americans and other East Asian Americans have faced significant, and Southeast Asian Americans have faced significant and disproportionate acts of hate and trauma that is impacting their mental health. I was very proud that this administration has already centered that in our discussion. We held a roundtable with Asian American leaders just a few weeks ago and where this was the centerpiece of the discussion, was addressing Asian American mental health in the face of rising Asian hate, anti-Asian hate. And so this is a huge issue for mine. In all honesty, we do not have enough culturally competent providers in this country, in this state, in the city, and we need to do much, much more to reach out to community organizations, to grassroots organizations, to connect with communities that are left behind by mental health care, as well as investing into our healthcare system and providing access to care. I think the work that Charles B. Wang Community Health Center does, for example, in Chinatown is really great, is really path-breaking. And those are the kinds of partnerships we would emphasize. Our resources at the city through NYC Well are translated, and we have cultural services Mandarin and Cantonese. And so anyone from the Chinese and Chinese American community should feel comfortable calling that number and getting help, access to help in the language of their choosing.
Yeah, Dominican channel in the back over there. Yes.
Carolyn Pimentel, del Corazón de la Medicina. Mi pregunta para usted es, hay muchas personas con problemas mentales entre los autobuses y los trenes. Muchos de nosotros que salimos de trabajar no sabemos cómo manejar la situación cuando quieren discutir con las personas que están sin hacer nada en los trenes. ¿Cuál es el plan que ustedes tienen para sacar a estas personas de las calles, de los autobuses y los trenes, y que nosotros como comunidad podemos estar a salvo y también los estudiantes al salir de las escuelas?
Okay.
Solo, puedo decir algo? So just wanna, because that question specifically is more like on the week, the mayor made an announcement like 2 or 3 weeks ago about the outreach, and that's with the different thing. But the health department is part of that. But I just want to frame that it's not only the health department; it's just the city as a whole working on that. En español sí que.
Sí, es posible. Es claro que hay una proporción de personas que estamos en los trenes, el subway, los autobuses, en las calles, que tienen problemas mentales que no son tratados. Es el prioridad de esta administración con el subway plan que el alcalde Adams y nuestra administración anunció ante unas semanas pasadas, es una prioridad número 1 para conectar a estas personas con del salud y del housing y los recursos que necesitan, y también aumentar la sensibilidad de seguridad y limpiado del público para usar los trenes, para usar los transportación pública y para sentir seguro en las calles. Es los dos prioridades. Uno es de salud público y salud mental, y uno es seguridad público. Y los dos es la prioridad de este alcalde, esta administración.
Mansur?
My name is Manzoor Hussain and I work for the Pakistani newspaper and TV channel. My question is, as we know, the mental health is considered a taboo topic in some of the Asian communities. So what do you think, how do you think that we can normalize the conversation among the communities? And plus, because of this pandemic, children are psychologically more affected. So do you have any message for the families of the children?
Thank you for this question. It's so important to me. It's very personal to me. I'm from the South Asian community, and mental health has impacted my family, and I saw very clearly the impact of stigma and discrimination on my own family members who lived with mental health issues. If I do nothing else in this job, I want to raise up this issue and start to break this stigma for all New Yorkers and in my own community, my own South Asian and Asian communities especially. And I think that's part of the answer to your question, is we have to talk about it. We have to model it. We have to show to the public that it's okay, that it is a sign of strength, not a sign of weakness. That means it's of strong character, not weak character, to be able to talk openly about your mental health challenges and move on, to continue pushing forward. So many immigrants in this country, my parents came to this country facing so many challenges and trauma and pain that they experienced back home in India, in the places that they left from India, and they moved on. But they did so without addressing their mental health and their well-being. And we need to be a new generation of people that make sure that as we're moving on and as immigrants continue to push on and do the work and work hard, that we take care of ourselves in the process. And as a city, we stand ready to do our best to provide those resources to immigrant communities all around the city, including my own.
Thank you, Commissioner, for sharing that story, that personal stories. Queens Latino?
Yeah, I'm Javier Castaño from Quiz Latino. This is a follow-up question from Berenice, from a lot of people here, is the mental health issue. I guess we already know how to control coronavirus, but the mental issue is like coming and it's around us. And I can tell you my experience just coming to this event in the subway, it was terrible. So my question will be like, we represent the immigrant community who has been impacted for the pandemic and now the health issue. Can you tell us step by step the steps that the city and the health department is taking to control and to help those people? And you don't have to do it right now, but we need that information to spread to our readers.
Yeah.
It's like what? Because you visit our neighborhood, that is Jackson Heights, a lot of unstable people around every single day, and they are very aggressive and all that. So we need more information about what the city is doing to reach out to these people and help them.
Sure. The subway plan that we announced is the beginning of a long-term plan to reform our mental health system for people with serious mental health issues, mental illness. It starts by creating what you say on-ramps, basically opportunities and conduits for people to get into care environments. We can all agree that living on the subway and living on the street is not where anyone wants to be, but they end up there when they feel they have no alternative. We need to create those alternatives in our healthcare system, in more affordable housing and supportive housing, And also, we need to work with our partners at the state and the federal government to change the policies and the funding for this system. We did not get here overnight. Our mental health system, I can say very clearly, is broken because we as a society, American society, has neglected this issue for decades. And now is the time, and we finally have an opportunity to reinvest resources into mental health in a serious way. I think you can see that commitment in just the first weeks of this administration, that it is the number one issue. We want to deal with the intersection of public health, mental health, and safety for New Yorkers, but it's the beginning of a long-term process of reforming.
Just a personal one. Why you decide to wear the mask?
Yes,
Yeah.
it's a very good point, right? So I choose to wear a mask indoors because it makes me feel most comfortable about my own risk. I have a child at home who is 2.5, who is unvaccinated, and I don't want to bring anything home. We know that there is a lot of, as we say, asymptomatic transmission. So I may not even feel sick or even know that I have COVID, and I can still bring it home to my 2.5-year-old son. I also have older parents in their 80s. I don't want to expose them when I see them. So for many reasons, and that was the message I was trying to say last week, you don't know what each of us have in our lives, who we are exposed to, who we live with, what our conditions are. We need to respect one another and our choices about wearing a mask. This is not a political statement. This is a personal choice for me to feel safe, and I hope and expect that you'll take those choices for yourself. But we are all connected by this virus, and so your choices don't just affect you, they affect other people.
Thank you, Commissioner. We're running out of time, so we're gonna do a few more questions. Over here.
Thank you. Yeah.
The reporter is there, the camera is there.
Hi, this is Victor from Get Division TV Network. We broadcast in New York, so all of Central South America, also here.
Hey.
I think one of your biggest enemies in the public health sector is fake news. For example, you're transmitting the right information. For example, if you talk to someone in Jackson Heights or Corona, which is our hub is, you tell them, hey man, I got vaccinated. And they'll be like, oh yeah, but I saw this video on WhatsApp of this doctor that I know with no credentials whatsoever says that you don't need the vaccine. You know? I know that you don't work in media, right? But perhaps maybe you can both answer to this question. All the immigrant media here, including myself. What is the health department doing to work with media to create content, especially addressing those specific concerns? Just a simple suggestion, maybe creating videos where you address the top 20 myths, right? Especially in the Latino community or in just the immigrant community, and then I guess maybe the word is demystifying those myths. I think that would really help because I've spoken to hundreds of people in our community where that's the same thing. Yeah, I would do it, but this guy that I know in Peru told me not to do it. What are you guys doing with that? I know it's a little too early to talk about it, but I think it would really help our community.
Thank you for it's a really important question. Number one, everyone involved in this COVID response has been under enormous strain, including the thousands of people who work for me because of misinformation. We had a president at the beginning of this response who questioned the science, who questioned whether this was real. Imagine, how do you mount a response in an environment where the number one leader of the country says, I don't believe in this. So we have to remember that this misinformation didn't come from nowhere. We know where it comes from. Now you also have social media companies, digital media companies, which has created a disinformation superhighway that makes it so easy for anyone to get access to the messages that they want, that confirm their bias, or that they can amplify. And the health department has already, over the last year in particular, really called out publicly in press releases and statements the effect of misinformation and disinformation on our public health response. Because you're absolutely right. The reasons why people are not getting vaccinated, not getting boosted, are often related to scientific misinformation and disinformation. So I think your idea is an interesting one, and we'd be happy to follow up with you.
Yeah. I want to thank you guys publicly because this right here is a massive success. Thank you, Dr. Bayona. We feel included. Not to throw rocks, but in the previous administration, this did not happen. And
Yes,
this is the
we know that's why this is a new administration. Let's put it that way. Okay, thank you for all.
Yeah.
So two or three more questions, and we'll have to
Two
go.
quickly questions. Well, my name is Jorge Andresat. I'm from the Spanish news agency
Right.
EFE. First of all, I'd like to ask you about the numbers. You've been talking about investing in health, in mental health. Do you have numbers? Can you put numbers on this increase from another year?
Yeah.
How the second one is about mental health people and how we as media, but also you as the city, talking about this problem, because sometimes those people that are victims are becoming like criminals. So people is having a lot of fear about the people that are in the subway, and they are victims of the system, not are the criminals. But like when you talk with people, people are afraid to go to the subway, and I've seen people looking at those mental health person in the subway and running out, going out, just seeing them. So,
okay.
I'll take the second one. What's clear is that this administration and the mayor has prioritized this issue, and we are out in the subways at unprecedented scale. Every night in the subway, you will see teams and teams of my staff, of our Department of Homeless Services staff, of our police department staff, engaging people with mental health and homelessness challenges and social challenges in a humane way, right? We are not, this is a humane health and public health response, and we're just getting started. We're only weeks into this. This was launched in early February, right? So we're only weeks into this effort, and we're already seeing a difference in what New Yorkers are seeing in terms of the city's engagement of these people. This is a very complex issue, and it's been around for a long time. And COVID has only made things worse with all of the economic and social insecurity. So I think we are trying to, I don't think anyone is trying to criminalize anyone in this process. This is about humane response to a really difficult, long-standing problem. Sorry, your first question was?
If you can put numbers.
Oh, investments. Happy to come back to you with
Yeah.
some more specific numbers.
We're gonna connect it. Last two questions, Telemundo.
Hola, ciudadanos de Telemundo. Yo quería preguntarle, basado en las cifras, ¿se sabe si la should I ask in English? Should I ask in English? Based on the statistics about mental issues in New York City, is more people after the pandemic with this problem than before, and how is the difference right now? What is the most common sickness about the mental health issues?
Yep, we nos vemos aumentado de síntomas de depresión y ansiedad en todas las clasificaciones de Nueva York, neoyorquinos. So esos son síntomas. Y los porcentajes son aumentados antes en comparación de antes de la pandemia. También los niños en la escuela están presentando síntomas de problemas en la escuela, de isolación, de problemas del behavioral, comportamiento en las escuelas en un porcentaje que es más aumentado del antes de pandemia. Todos los grupos de neoyorquinos está sentido el impacto en la salud mental de esta pandemia, y no es temporaria, no es temporal. Es un problema que necesitamos tratar o confrontar por las próximas semanas, meses y años.
Okay, gracias. La última pregunta allá en Manhattan Times. I'm sorry, the last question for Manhattan Times.
Okay. Hi.
You mentioned the COVID treatments that are currently available. I'm wondering if you could give us a sense for how many workers are taking advantage of them.
Yep.
it's the detail.
Thank you so much for raising this. So important. Treatments, when they first came out, sometime in January, were very restricted. Federal supply was very restricted, so we had very few amounts. And so we have a partnership with an online pharmacy where New Yorkers can call 212 COVID-19, get assessed, and they will deliver the drugs same day to your home. As well, we have, now that we have more supply through our federal government and through the state, we are ensuring that we are distributing antivirals to our federally qualified clinics, our primary care clinics, as well as large chain pharmacies, as well as things like CVS minute clinics all around the city. So New Yorkers can call 212 COVID-19 or go to nyc.gov/COVID to find the nearest place to them where they can get assessed for treatment. You still have to get assessed by a doctor in order to get prescribed treatment. The treatments that are most available and what we recommend for most New Yorkers is the oral antiviral pill, which is called Paxlovid, and that is a 5-day course of a pill that can get delivered to your home or you can get from your provider that you take in your home. And the main thing is it reduces symptoms and reduces hospitalizations and severe illness. And so we encourage New Yorkers to start taking that, get assessed for it as soon as they feel symptoms and as soon as they test positive.
Would a smaller community pharmacy have access to them as well?
Yes, increasingly yes. Increasingly yes. Again, this is an issue of supply, and we, now we're dealing with more supply. But it's also, I want to be clear, it's also why our partners in Congress need to ensure that we have the federal funding available to us for this COVID response. And I know they're debating about this right now. They've been such good partners to us. We can't have them stop now because our access to supply of antivirals is on the line.
Thank you.
¿Podría decir eso en español, por favor? De una manera.
Okay.
So,
hay algunos tratamientos nuevos que tenemos y la cosa más común es la pastilla que se llama Paxlovid y es una pastilla que toma por 5 días y puede quedar en su casa y prevenir la hospitalización y los síntomas muy graves de COVID-19. La manera de accesar el Paxlovid y otros tratamientos es que se llama su doctor primario, su médico primario, o 212 COVID-19, 212-268-4319. Y eso es el mismo día puede tener una cita con un médico de telemedicine en la computadora o para el teléfono, y el mismo día puede tener un delivery, entrega en su casa del curso de Paxlovid.
Gracias, thank you, Commissioner. So now
Lo siento por mi
español. No. So would you like to? Now you have all the media in front. Your closing remarks and a couple of.
No, I feel very strongly, and I thank you. Number one, thank you once again for being with us today. I feel your role in communication with New Yorkers, the most diverse city in the world, is so crucial. And look, we are learning every day about how to communicate about these very complicated issues. We've never had to do this before. We are doing more communication around public health and COVID than we've ever done before. Nobody knew who the Commissioner of Health was 2, 3, 4 years ago. Now everyone knows, and that's okay. That's good. That means I'm glad to be starting a dialogue with you because I know how important it is to our public health response to be reaching into the communities that are most impacted, and you are the trusted messengers. So
Thank you, Commissioner.
Okay.